Hi, let's give an update on my submuscular ulnar nerve transposition recovery. I'm at 7 weeks since surgery, 7 weeks and 2 days. Went to the doctor 8 days ago, and he, looked things over. There's my surgery site and everything. He said he thought it didn't look good. He was very happy with how things were progressing. I talked to him about my range of motion. He said as far as going all the way up with it, he said I could force that up more. He said it's safe to do that as long as I'm not, hurting myself. When I do, it gets pretty tight, or real tight right through here in my elbow there. But I'm getting a lot closer to my shoulder than I was, getting within a couple inches now of touching my shoulder there. Whereas before I was real far away, long time, back there in the last video. So I've gotten better there. But he said everything's healed up in there. It's okay to do that. As far as the way things look, I talked before in a video. I feel like sometimes there is maybe a lump here, or not maybe, there is for sure. You probably can't see it on video. Sometimes a spot that sticks out right here on the inside part of my arm. He said he thought that was still normal. He said that was scar tissue and still a little bit of swelling, and it is kind of swollen right through here compared to my other arm. Sometimes you can't really see the difference right now, but it is kind of swollen in there. So he had told me he was okay with me lifting 5 pounds with my arm. That was, like I said, 8 days ago, and he said he wanted me to start rehab. I can't get into any rehab until June 30th. That's still 12 days away. I've got one scheduled for June 30th and one scheduled for July 7th, a couple rehab sessions. So in terms of what I've been doing on my own, I started with some actually 3-pound dumbbells my wife had, doing just some 3-pound curls with it to start off, and progressed to 5-pounders like he had said. Then I moved to 8-pound, and now actually this morning I'm doing 10-pound curls. So that's more than what he said to do, but everything feels fine. I don't feel any kind of sharp pain or any kind of strain or anything. But I've been doing 10-pound curls, with just dumbbell curls. Hard for me to show you them in this chair, but obviously the right form, but you know what a dumbbell curl is. Doing 10-pound dumbbell curls, about, sets of 10, maybe like 3 sets of 10, I think I did this morning, I don't know. And then doing some modified push-ups actually this morning. I did some modified push-ups for my knees. Did about, I don't know, maybe 2 sets of 10 or 3 sets of 10 of those. I can't remember. The first time that I was doing those, my left arm was kind of shaking as I was doing them. It didn't feel super hard, but my arm was just shaking in terms of not being used a lot. But it is getting stronger. It feels good to start being stronger. So I'll keep moving on with things. And keep progressing. I'm listening to my body in terms of not doing anything that hurts. But I'm anxious to get to that rehab in 12 days, because then I can kind of talk with the rehab therapist about what they feel is safe, what he or she feels is safe to do and not to do and stuff like that, and pushing. I'll get a little better idea, I think, of what I can do. But I am, like I said, pushing past what the doctor told me to do just because I feel like I can, and nothing's hurting at this point from doing it, and it feels good to get some strength back in this arm. As far as use of the arm, I am getting pretty close to normal, using it for everyday activities like I had before. Not exactly normal. There's still some things I don't do with it that I used to do before, like shutting the truck door, for instance. I'll do it real slowly, but just like a normal motion of getting in, reaching out, pulling shut. That feels like I don't want to do that yet. It kind of feels like I might strain something kind of pulling, so I'm usually reaching across. But that's just one example. There's other things too, but I am pretty close to normal now with it. So I'm able to do pretty close to my normal activities, except for obviously working out and doing full push-ups and working and that kind of stuff. I'm not to that point yet, but progressing quite a bit. So happy with that. So yeah, I'll keep posting updates, and like I said, making a little bit of progress each day and getting better, and that makes me feel good that to get closer to normal. So to get some strength back in it, even though I'm a long way away from where I need to be, I am getting some progress, and that feels good. So all right, bye.